So certainly I'd like to tie us into how at the City of Calgary we used a health impact assessment into the Nose Creek Area Structure Plan as the process and as a tool for our decision making. Just the couple of things I'd like to cover. What's the connection and the tool of the HIA, how we integrated it into the Nose Creek Area Structure Plan, the process that came out of that, the conclusion. Certainly a big win for us was that it was approved at council, and I'm still standing, so I survived. And certainly then we'd like to end with a time for question and answering. For those of you who know me, I have always had this interest or this belief that there is a connection between health and our environments and our built environments. And certainly in my practice as a landscape architect and the research I did in that field with therapeutic landscapes and healing gardens, it's something that I wanted to borrow from and bring that into planning. That there was a field that had developed from that in the early 2000s where we connected designers, architects, landscape architects with physicians, and they started to do studies, and they found that there were not only physiological and mental health benefits, but there were also cost benefits too. And certainly that is something that enables us as practitioners when we come to the table and we're trying to find solutions for our clients. There is that piece that we need to consider, is there a cost benefit value to it as well. So for example, if you're not aware, with therapeutic gardens and hospitals, it wasn't mainstream. And what they did find that as they did more research, they found that there was savings in time in terms of people who had view to natural landscapes would heal quicker, they would take less medication. Staff who were in an environment in the hospital where there's a lot of stress, that they would actually they were able to kind of have stress relief from those views. And so building upon that, they found cost from job satisfaction for your employees, retention, certainly one piece, and just the amount of recovery time was shortened, so that was also cost savings for hospitals. So then I wanted to borrow that idea and thought, well, how do we bring that into planning? How do we bring that idea into the built form in our community? So that was kind of a starting point for myself. As Murray kind of mentioned earlier, it's not a new idea how we've been able to use planning to connect to health. So from the industrialization period, and we dealt with infectious diseases through infrastructure, and today chronic diseases is the top piece, and inactivity is one of those factors. So many of you guys in this room are probably well aware in terms of when you're developing your plans or your policies, we're always looking at that walkability piece, that streetscape piece, that built form piece. And what this is really supporting us is saying that there's not just that perceived value to it, that we might associate it more from an architecture and an aesthetic piece, that there's actually a health piece. This was one of the graphics that we used in our process to inform the public. We worked with our stakeholder groups and even internally with our technical advisory committee with staff, certainly just to prove that there is this connection between the built form and health, that a major organization like the World Health Organization has actually recognized that. And really putting it into perspective that as planners, as designers, as developers, we have the ability to really action upon physical inactivity, which is one of the 4. And it was a bit shocking for me to realize that 80% of deaths, as reported by the World Health Organization, is tied to chronic diseases. And then if you notice in the guy's pocket, we're Canadian, there's a $6.8 billion kind of ticket associated with that. In terms of the tool of a health impact assessment, one of the things that I consider is society is about systems and how you distribute resources. So when you look at planning and development, some of the tools that our colleagues might use in transportation is a TIA, which is an impact, does an assessment on the impact of development on the transportation system. For our colleagues in parks, they have a BIA, which looks at the impact on the natural systems. And perhaps until now, recently, as planners, we have the ability now to use an HIA, which is really the idea of an impact of development on people systems, where the people system being our health, or our health in terms of the community that we're part of. I think one of the things that was important in learning more about health impact assessments and how we can integrate that into planning is that it's that ability of taking the time to reflect upon what we're doing and what our intentions are. I'm sure many of you in this room feel like we're being rewarded for doing work really quickly. It's a fast-paced world. Just keep going, get to the end, and that's it. But it's the idea that, you know, perhaps you need to pause and reflect and think about what is the outcome, what is the potential outcome, and what kind of information do I need to do or research up front to avoid coming or hitting those roadblocks later on. So it's kind of like the analogy of when a pilot comes onto the intercom and says to the passengers, I have good news and I have bad news. Good news is we picked up on an awesome tailwind, so we're going to pick up speed and we're going to go faster. The bad news is our navigational tool is down. So sometimes I feel like that's how I'm operating sometimes as a planner, is that we're just going full tilt. But where is my navigational tool? Where am I getting my research or my information to guide me to the best decision? So in terms of how an HIA can benefit a planner, in the Nose Creek Area Structure Plan process, we were quite lucky to have two things. One was willing partners from our landowner group and their consultants who are in the room here, who were able to embrace the idea, and certainly they were already working within that parameters of understanding the connection between built form and health. But it also gives you direction in your engagement plan. So we'll get into what we call, or what I call, the Nose Creek Area Structure Plan model. Is we use what we've seen as the benefit of an HIA into the planning process. So it's about maybe changing some of the approaches, when you interact with people, how you interact with them. The other benefit is that it provides the research to support our decisions. I think many times when you're at a conversation with other consultants, they have their science, their TIA to support why they need X, Y, and Z. Or you have Park saying, we have the biophysical impact assessment that says, you know, these are the measurements. Now we actually have the research that would support saying, well, there is this connection between built form, and there's a reason why we're asking for the narrower right-of-way or a change in the approach to the way we might integrate park space into the built form, because we have the research that connects the two. So I think that was a valuable tool, and I saw that as an asset for us as planners. And as Murray mentioned, it really does bring equity to the conversation, something that I found that didn't necessarily have a tool to use in making my decisions or proposals going forward. In terms of other benefits, again, I think the middle one resonates the most for myself. It really is about having everyone around the table focusing on the impact, the health impact, because health impacts everyone. And it takes away that, for this municipal staff, the little hat piece out of that table, where that conversation where you have someone that's really focused on what their metrics are or what their end goal is because of their department or area of expertise. But then what it does, because you're focused all on a health outcome, people are able to use their technical information or their professional opinion to guide us towards that larger cohesive decision. The other key thing that resonated with me, I had the opportunity, I met Murray and Marla in Washington at a HIA conference, and this was one of the things that was mentioned, and sometimes I forget about it in my practice, you know, what is the difference between equality versus equity? And I think on the image on your left would be something that when we're moving really quickly in terms of meeting our targets or getting our project done, we just do the bare minimum, or we do what's needed. We give everyone, if you will, say, their ability to comment on an application. Here's your circulation, give me your comments, and then that's it. We're closing the engagement process or that fulfills that piece. And sometimes it is difficult. Certain communities may need a different set of guidance than another community. There are some communities that are more savvy, or they're more put together, or they have a longer experience or a bigger pool to draw from, whereas arguably, say, in the new communities, it's a different group of people that aren't as established or as aware of the planning process. So you may need to consider giving them a separate set of tools in order to really come to the table and have a conversation. That's one of the things I'm hoping that you would consider as you leave this lunchtime is, how can you better bring equity into your planning process there. So for the Nose Creek Area Structure Plan, I'll take you guys through the steps. What we did do is look at integrating these 7 steps into the planning process without really taking us off course of what is the intent of an area structure plan, so the policy plan. We were cognizant about timelines and deliverables as well, and working with the stakeholders there. So this is what we came up with. We felt that in an everyday practice, as for a planning process, we do a lot of the key elements. We do include engagement. We do identify stakeholders. We do touch base with them and use them as part of the decision process. How completely we do that, it may vary. So when we did do the screening and whether or not an HIA was required or useful, considering that the plan area is 679 hectares, it's adjacent to what would be future Keystone. Just in case you're wondering where it is, Cross Iron Mills is just to the northeast. And there's potential that this is going to be the future home and future employment place for many, many people. And then in terms of the next step in integrating scoping, and this was done with our stakeholders, with our landowner group and with our internal technical advisory committee, we drew on what was our foundation piece for the city. So we looked at the MDP and then went from there. And certainly, in part of the scoping process is providing that research piece. So where the HIA was valuable is that it gave us that opportunity to inform the audience that we were, or the group that we were working with, or the audience, say, if it was at a public information session, that would be reviewing the plan itself. And sharing the research piece there, certainly that it's the idea in a community plan that if you have destinations, people, and then you have places that will draw people in your neighborhood, they were more likely to hopefully take an active mode of transportation there. And it's also about the links. What are the linkages to those destinations? Are they designed for the automobile, or are they designed for the people to get there in a safe place? So we used some of our great planning tools. We used kind of a visualization process. We went on site with our landowners and we did a visioning and core value session where we drew ideas of what is it about the sites, what are the attributes of the sites, what are some opportunities there. And again, it was also important to provide that framework, that you do provide a boundary in which you work from, and that was basing it off our municipal development plan, something that all our policy plans are based from. So we took those ideas and we translated them into how some of those attributes could fit under the different sections of the MDP, and then we started to create plan area principles. As part of the scoping, then we use drawing and dialogue as a tool, certainly something we do a lot of in landscape architecture as well. One of our strengths is the ability to draw what your ideas are. So we pulled in some landscape architects and we had them work with us to understand what are the land use typologies. Again, we wanted to step away from getting right into the details of where exactly will the single family homes go, where will the commercial piece go, but about what is it are the elements within these land use typologies, and what is it that influences health. So we ended up focusing a lot on the public realm, streetscape, circulation, and adjacencies. And those were kind of the key areas or themes that we focus on in the policy plan as well, and also in our decision-making process. We did that with the landowner groups, and then we kind of vetted that back through our technical advisory committee. So just like the name says, it's a technical advisory committee. They reviewed it. They provide their technical analysis to ensure that we weren't causing other issues, and really trying to prioritize or see where those questions or decision-making tools could be. In terms of the assessment process, we started off on the left. Many of you may be familiar, is the ULI. There are 10 principles, and we use that as a foundation piece. There's no point, starting from scratch. That was a good place to start from. And in doing so, we kind of shaped our own principles for the plan, and this was done with our landowner groups and their consultants, and what would resonate for Nose Creek. With these principles, so active areas is really about focusing on people and making the spaces active for people to essentially encourage them to do physical activity. People places is also looking at the connections and destinations. Mix and mingle was the idea of mixed use, the idea that it strengthens the destination piece. So we looked at these principles and we used them as part of the decision-making process. So that would have been where we would have been in the model, which was the strength test, where we tested against technical review, looked at the studies, and we use those principles to determine whether or not you would pass the health check. Does it meet the principles of the plan? So for example, when we went out for an open house, we didn't ask the questions, which option did you like better, A or B? It was more about, well, we came to coming up with these questions and these decision-making points with our stakeholders, and those were the principles. So the question was, which of these options align with those principles? So which one arguably puts people first, that it would encourage people to move? Which one recognizes the economic value, the idea that there is economic value in walkable, mixed-use, transit-oriented, rich communities. So we kind of guided them through that. And then came the recommendations. So on that spectrum of the type of HIA, I think we're kind of an intermediate, because it was about a year-long process, but we could actually integrate those ideas into the recommendations. Because we started the process at the very beginning with health in mind, we were able to guide it completely through all the checkpoints of an HIA. One of the key outputs then of the recommendations are in the area structure plan itself, in the policies. And something that was new is that we had an entire chapter called Healthy Communities. So I'm not sure if any other area structure plans have that, but essentially it is a set of policies that is going to govern the entire plan area, and it focuses on some of those ideas that would encourage people to make healthy choices. And again, it was kind of organized by the policies were organized by the public realm, streetscape, and circulation. And I think another big win for us as well is that we've also acknowledged the importance of those healthy planning principles. Because we spent that time and worked with our stakeholder group, and because we did the research for it, we thought it was important to include it into the body of the policy so it wasn't lost in the future phases. And I think another question people may come and ask is how, was there resistance from the developer? And they were supportive. The consulting group that worked for the developer was supportive of it, because there was the value piece that they also saw, that later on in the future stages of planning, there is a clear set of criteria and principles from which you can make your decisions upon. So this is the plan. Some of the unique features of the area is that we actually have transition areas. We felt that because we wrote policy in place where we really focus on adjacency, public realm, streetscape, and circulation, that at the end of the day, the exact line of where a industrial area and employee-intensive area needs to be can be determined later on through the process, and that's where the HIA was also a tool for that. Another key piece was through the conversations of equity. The landowner group had said, well, our industrial areas are quite low in terms of community amenities. We have neighborhood activity centers, but what do we have in the areas where people spend most of their time working? So we came up with the idea of the industrial hub. And certainly it's meant to be a vibrant space where people that work in the area can gather. I don't know if it's a good example, and Steve, you can correct me if I'm wrong, but think about Granville Island. You know, you have your artisans, it's a gathering space, but maybe a little bit more industrial. Because the area is an industrial area, because there is an NEF contour, there's also opportunities there to do smaller, if you will, bays for smaller businesses and artisans to kind of integrate there. And it is in the body of the ASP. So for those of you who've worked on policy plans, sometimes including something like an HIA into the body of the area structure plan can be a win for administration. And I think in this case, it'll be a win as well for the development to go forward. So one of the things I'll probably just wrap up quickly is that the front end of the area structure plan is designed like a typical area structure plan. We have our open space policies, we have our communities in our neighborhoods. And we organized all of the policies based on those themes. But what the HIA does, which is in the appendix of the document, is that it really reorganizes it back into the principles. So we thought it was important going forward, if someone were to read the plan and had to implement it, or going forward if someone wanted to develop in the area, what does that mean? So we provided the research, we provided why it links to health, that principle. We also provided on the side some of the key policies that would support it. And then we also further separated by stages of planning. I think sometimes our documents at the city may not be as clear as to when you would implement which type of policy. We purposely kind of separated in that area. And again, the idea was potential for evaluation, and for monitoring, it's easier to track. Certainly, if you come in with an application and we're trying to determine whether you've met the health check, if there's a negative health impact, or is this meeting with the principles, we can say, okay, you're in this area, this is the industrial area, these are the so many policies that apply to you. And then we could do a pre and post analysis and consider, have you met it at your initial onset? Well, maybe, maybe not. And then when you come back, let's amend it and see if you can do that. What it also does is that we also have a table where we've put the 220 policies, and we've tied it to each health principle as well. So when you want to look back at the policy, we can then understand which principles are best achieved in this type of document, or which ones need to be improved upon, or maybe potentially there might be new research that might influence how we change that. So here are some of the benefits of this health approach that we took. We thought that there was transparency through clear goal setting and then the objectives and the health outcomes, because we did work with the group from the beginning. One of the benefits of using an HIA is if you engage with your participants beyond just polling, or engagement beyond just polling them, which option do you like, one or two, but allowing them to phrase the questions in the decision-making process. You build that relationship and that transparency. You also, in the end, actually, the time frame, you do a little bit more work at the front end, but when you get to the end, you get better buy-in, you get better support. And I think from a professional point of view, once that life of that project kind of ends, so when this policy plan ends, you potentially also have the buy-in for the next group, or the people who will be remaining or who will be impacted to go forward. So in conclusion, so what is your navigational tool as a planner? My ask is maybe consider and explore the different types of HIAs, and that the value is that it does bring equity to the table, and that just that front end research provides support. One of the examples someone gave at the conference in Washington was that, and I forget which region was, but they wanted to improve transit service. And it was about getting more people on that bus. So arguably you get a higher ridership. So they made that decision going forward. Yep, this sounds good. What we're gonna do is we're gonna limit the number of bags each person can bring on the bus. So yes, you will fit more people, increases ridership. But then through the HIA, what they found was that that decision actually had a negative health impact. What ended up happening is that this route was also a key route for people to get access to groceries. So if you're in a community where most people don't have cars and they use transit, and it's more evident in the States, you're surrounded by your 7-Elevens and your McDonald's, this was the route to get groceries. So by limiting the amount of bags, you are then inadvertently limiting people's access to healthy foods. So the HIA was able to bring that to the table and kind of correct that. But that was, the event had to happen first, and arguably you had to go through all that changes. But if we had done an HIA at the front end or had explored those ideas earlier, we could have avoided that. And just to close, I think we have the opportunity to shift the distribution of resources to have a positive impact on the health of people by using health. And one of those tools is an HIA as your compass as you navigate through your projects.